Hey, let's talk about something almost everyone has experienced at some point: back pain. It's one of those things that can sneak up on you after a long day, a tough workout, or even just from sitting too long at your desk. But here's the thing: not every twinge or ache in your back is a sign of something serious, and definitely not always sciatica. You might think every ache in your lower back means you've got a slipped disc, or worse, sciatica. It's easy to jump to conclusions, especially with all the scary stories you hear online or from friends. The internet is full of information, but not all of it is accurate, and sometimes it just adds to the confusion and worry. But hold up, not every back pain means you have a disc problem. In fact, most cases of back pain aren't caused by anything as dramatic as a herniated disc or pinched nerve. There are so many different reasons your back might hurt, and most of them are much less serious than you think. It's easy to panic when that pain shoots down your leg, especially if it travels below your knee. That kind of pain can be alarming, and it's natural to worry that something major is going on. But even then, it doesn't always mean you have sciatica or a severe nerve issue. Yes, that can mean a nerve root irritation, maybe even spinal stenosis. These are real conditions, and they do happen, but they're not as common as you might think. And even if you do have some nerve involvement, it doesn't always require drastic treatment or surgery. But here's the thing: if that pain is mostly sticking around your lower back, or just your buttocks, it's probably not sciatica. Sometimes pain can feel intense but still be related to something much simpler, like a muscle spasm or a joint that's a little irritated. It could be something totally different. There are a lot of structures in your back: muscles, ligaments, joints, discs, and any of them can cause discomfort. The good news is, most of these issues are temporary and can be managed with the right approach. We're talking minor disc issues, maybe spondylosis, facet joint problems, or even just a bit of inflammation from overuse. Sometimes it's just your body's way of telling you to slow down or change up your routine, or even just a simple strain or sprain. Maybe you lifted something the wrong way or twisted a bit too far during a workout. These kinds of injuries are common and usually heal with a bit of rest and the right care. Now, this is where a lot of people go wrong. When pain strikes, it's tempting to look for quick fixes online or try whatever worked for someone else. But back pain is personal. What helps one person might not help another, and could even make things worse. I see it all the time: folks jumping on YouTube, searching for back pain exercises, and following whatever comes up. There are thousands of videos promising instant relief, but not all of them are safe or right for your specific problem. But here's the truth: every exercise isn't for everyone. Your back pain might need a totally different approach than your neighbors or your favorite fitness influencers. Some of you might actually need stretching. Tight muscles can pull on your spine and cause pain, so gentle stretching can help loosen things up and bring relief. Others, you'd do better with strengthening. Weak core or back muscles can leave your spine unsupported, so building strength is key for some people. It all depends on your pain type, the cause, your lifestyle, and a bunch of other factors. Things like your age, activity level, job, and even your posture all play a role in what's best for you. That's why it's so important to get assessed properly. A professional can figure out what's really going on and guide you toward the safest, most effective plan. A right diagnosis means the right exercise, and that leads to faster recovery. You'll avoid wasting time on things that don't work, and you'll heal better and stronger. Don't just guess. Your back is too important to risk with random advice or one-size-fits-all routines. Don't risk making things worse. The wrong move can turn a minor ache into a bigger problem, and nobody wants that. Get real guidance. A physiotherapist or healthcare professional can help you understand your pain and show you what will actually help. So before you start that next miracle back workout you found online, talk to a professional. It might take a little more effort, but your back will thank you in the long run. Consult Dr. Usman, physiotherapist at Smart Care Medical Center before starting any exercises. They'll help you find the right path, avoid setbacks, and get you back to doing what you love. Trust me, your back will thank you. Take care of it, and it'll take care of you.